Welcome back. Doctors say nearly 75% of women experience morning sickness or nausea within the first 9 weeks of their pregnancy. For some women, it doesn't stop there. The sickness continues and actually gets worse. Emily Noonan spoke to one local woman who is dealing with just that.
At first, Brittany Knight thought it was just typical morning sickness. Then it turned into afternoon, evening, and night sickness. She knew something was wrong.
And it got worse and worse, and I couldn't keep fluids down, I couldn't keep food down. We spent many days at the hospital.
It wasn't until week 12 that she went to the Rochester Regional Hospital to figure out what was wrong. Dr. Derek Tenhopen diagnosed her with hyperemesis gravidarum.
She had more than 5% weight loss. She had dehydration, starvation, and needed intervention. She needed a PICC line put in, which is a special central line that they thread through your vein and into your heart so that you can get not only medication, but IV fluids.
Which seemed to help, until one night something unexpected happened. She was rushed to the hospital and found out that she had sepsis through her PICC line. Now she's on IV, which is administered every 3 days. Her husband, Joseph Moayo, found himself doing things he never thought would be required for an expecting father.
Switch out her IVs. I would have to administer medication through a syringe and inject it, administer it into her IV. I would have to flush out her IV. I would have to give her fluids.
And according to Dr. Tenhopen, some cases can get much worse.
Some women had to actually terminate their pregnancies because they would actually die from hyperemesis gravidarum.
There was a lot of moments where I was really scared for her. I didn't know what was going to happen. I thought there was a couple moments where I thought we were going to lose the baby. I thought there were a few moments where I was going to lose her.
Dr. Tenhopen says since they intervened when they did, the risks for Knight and her baby are very minimal. And Brittany Knight is now close to 34 weeks through her pregnancy. And though she's still going through some of the symptoms of HG, Dr. Tenhopen says baby Theodore is going stronger every day and should be just fine when he arrives.